removed in February and has since had reconstructive surgery. And joining us now for a look at this kind of proactive and preventive surgery is Dr. Victoria Dooley from St. John Providence. Good to have you with us.
Always great to be here.
First, let's just start with your overall, feeling and response to her big announcement today.
I think it was a very courageous decision. I think it was a very selfless decision for her to want to be around for her children that she has, to want to decrease her chances of breast cancer from 87% to down to like 5%. I think it was a very courageous decision.
Let's talk about genetic testing. That's what the gentleman you heard on Good Morning America say. This could be a game changer when it comes to testing. Genetic testing is expensive, and not everyone can afford to do that, first of all.
It is expensive.
Often not covered by insurance as well. There are kind of recommendations in place. Not all women should be running out going to get genetic testing. Who should be just considering even getting this test to find out if you're at greater risk?
Sure. People with a strong family history of breast and ovarian cancer in their family. Women who had breast cancer at an early age, meaning less than 50. So if you're someone whose mom or sister got breast or ovarian cancer in their 30s or their 40s, that's the type of person who'd want to consider genetic testing.
If you find out that, as it's referred to, BRCA1 or BRCA2 positive, in Angelina Jolie's case that we heard that she was told by her doctor she had an 87% chance of developing the disease. Yes. It's not always that high, correct?
It's not always that high. Each individual has different risk factors. The average is about a 40% increase of getting breast cancer, but about 60%,
right?
But a 40% increase of getting ovarian cancer. So the BRCA1 increases your risk of getting breast and ovarian cancer.
What do you do with this information? Obviously talk to your doctor first of all, right? If you get a BRCA1 or BRCA2 positive result. But let's say you don't choose the more extreme route, which is what you did. What else can you do as a woman if you
have to be diligent about getting screened? So MRIs, mammograms, all those things can detect cancer early. Now these aren't going to prevent the breast cancer from occurring, but the earlier you catch it, the higher likelihood of surviving the diagnosis.
Big decisions women have to make.
It is.
Always take them to your doctor and see if you're a candidate to be tested. Dr. Dooley, thank you very much.
Thank you.